Hi, I'm Dr. Kevin Anderson, and today we're going to be using the Compex HD composite warming dispenser from Adent. Um, there are numerous benefits to warming composite. This is very well documented, and I've been warming my composite since dental school. In fact, back then I used to put my compules up on top of the overhead light and hope none of the faculty members saw what I was doing. More recently, we've used the CalSet warmer as kind of our daily workhorse. The Compex HD is a nice entry into the composite warming game because it's free. You don't have to plug it into anything. You can take it room to room, really easy to wipe off, and it heats up in less than a minute. So you don't have to wait for anything to do what it's supposed to do. If we compare this to some of the other composite guns like this on the market, one really nice feature that I think I really like about this one is that you can swivel the composite into all sorts of different arrangements. Some of them you're forced to just have it on the bottom, but as we know, when we're working around the mouth, that can be a little bit difficult sometimes for tricky to access areas. Speaking of tricky to access areas, today we're going to be using it on some really minimal class 2s where there are some hard to reach areas. Warmed composite is really nice to get into all the little nooks and crannies of those areas, and you're going to see how we use that in just a second. Alright, so today we're using the Compex HD warming gun. We have some relatively minimal class 2 preps here, which sometimes is difficult to get composite into the tight little nooks and crannies. So we're using a heated technique to kind of inject into the small boxes of the preparation here. Is it back to back? So I always like to take one matrix out before completing the second restoration. As you can see from how the matrix bands are in place on these minimal class 2 preparations like this, getting the composite into those tight spaces is often really difficult. With the final result here, having that warmed composite changing the viscosity of the material really allows excellent adaptation into the cavity walls and gets a great outcome and allows us to be much more minimally invasive for our patients to have long-lasting restorations without removing too much tooth structure.